If I could tell what the name is, I just let go. Yeah.
All right, guys. Everybody ready? Yeah, awesome. Well, welcome to a one-of-a-kind class. I've never actually done this class before, and especially not in this way. So my goal tonight is that you guys walk away from here with tools, not just how to address pain, but how to address the cause of pain, and getting to the root cause of it. And so we've got the three of us tonight, and I know that's a little different for you guys. Obviously, myself, Dr. Jake. There's a lot of people watching online tonight, so if you want to turn around and say hello, they're all back there on the camera. Yeah, obviously myself, I've got about a decade of experience here in this office. Cheryl, if you guys have seen her before, she's almost 4 decades of experience. And then our guest speaker tonight, Miss Taylor McGuire, or Mrs. Taylor McGuire, she's been a nurse for almost a decade herself, and just in the last 2 years has started health coaching. I'm not going to tell too much of her story because I know that's a lot of what she wants to talk about tonight. But I'm going to hand it over to her, and then we'll get really deep into this. Okay, guys?
Yeah. All right, my notes are on my phone, so if you see me looking at my phone, and then I don't... Like that? Is that good? Okay. Hi, everyone. My name is Taylor McGuire, like you said. I've been a nurse for, it'll be 8 years. Actually, it was just 8 years, not too long ago. I started working in emergency medicine at first. I did the emergency room and then the operating room for a while, and that's all part of my story. This kind of workshop that I have put together, I entitled Embrace the Pain, because I know a lot of people out there are struggling with pain, some sort of pain, whether it's arthritis or whatever sort of chronic pain. So that is kind of what I'll cover tonight, and I'll kind of start with my own personal journey with recovering from some severe pain. If I seemed a little scatterbrained, it's just because my husband just had surgery, and we have a 3-year-old and a 1-year-old at home, and I've been a little occupied. He tore his ACL playing soccer, and so he had that repaired. Not that I'm not prepared for tonight. I totally am. I could talk about this stuff on the street with anyone for hours. So if I seem like I'm kind of all over the place, it's 1, because I'm super passionate about this and can talk about this forever, and 2, because there's just a lot going on right now. And so that's why I have my notes here to try to keep me on track. So I will just kind of talk about my story, enter into a little bit of like what I do as like a mind body coach, I like to call myself, and how our mind and our bodies are just very intricately connected when it comes to just illness and pain in general. And then I actually have prepared a short like mindfulness, almost like meditation practice for you all to kind of experience a little bit of just one of the many tools that are out there to help not only ease pain temporarily, but also in the long term. And then I'll leave a little space for kind of Q&A at the end. So that's kind of how I'll go about it. So my story, I will try to keep this as concise as possible because it's very, very long. But when when I was about age of 25, so that would have been like 6 or so years ago, I had just kind of started my nursing career. I was working in the emergency department, and I remember very vividly the evening I was working night shift, and I had started to get like this pressure in my face and like this frontal headache and then a little bit, behind my head. And I called in sick to work, and then I called in sick again, and I went and saw my doctor. And then that headache, basically, I had that headache for about 3 years straight. That was my first symptom, was just a terrible headache here and here that just wouldn't go away. And I saw pretty much every doctor under the sun you can think of. I was driving up to Omaha to see a neurologist, a pain specialist, saw 2 different ENTs. And eventually that pain also went into my jaw. I got diagnosed with all sorts of things, chronic migraine, post-traumatic headache from a fall that I had a few years ago where I hit the back of my head. TMJ I was diagnosed with. I also had back pain in there somewhere in the mix. And I was pretty miserable. I was on about 8 different prescription medications, sleeping medications, anxiety medications, medications for my gut because I was having gut issues. And I did all the things. I had Botox injections and nerve blocks, and I did chiropractic care and massage and physical therapy and like all the things that people kept telling me to do to make this headache go away. And it still wasn't working. I was just, struggling every single day to just even do the normal daily things. And then one evening in the bathtub, I was just searched on like my Spotify for a podcast, and I just searched the words chronic pain. And that's where I kind of discovered the world of mind-body medicine and how our emotions are actually not just in our brain, they're stored in our physical body, and that they could actually be the cause of my pain, which seemed so outlandish and crazy to me. But I thought, I have nothing else to lose, so I might as well give this. It was a journaling technique that this therapist was talking about. So I decided to give it a try. And that kind of led me, like I said, into the world of mind-body medicine, holistic healing, not just looking at each organ system by itself, because while I was seeing a neurologist for my headache, that was just focused on my head, right? But what else in my body was affecting that pain on a daily basis? And that's where I actually started to feel better, is when I started to approach it from that perspective. So now flash forward to today, I don't take any medication for pain. I don't generally have pain on a daily basis. I still get pain, but not chronically, because pain is our body's way of communicating with us. So I'm not going to say you're never going to have pain again, or that I've never had pain again. That's just not possible. That's how our body communicates to us, is through those pain signals. But that very severe, debilitating like pain that I used to have, I just don't have that anymore. And I did not learn any of this in nursing school, which was like, how did they not teach us this? Like, if I would have kept going kind of down that same path with the conventional doctors and the medicines and the treatments and all the things, I probably would still be on all that medication and still in that much pain. But instead I'm here, and therefore why I decided to shift my career focus from working in the hospital to working individually with people on a deeper level, to try to get more down to the root cause of a lot of these symptoms that generally have to do with a mind-body connection or nervous system. If you've heard nervous system dysregulation is a big hot topic right now, that kind of plays into everything. So I'm just going to go through a little bit of background of what mind-body medicine is. I know a lot of you will have different knowledge on this topic, so I'm just going to kind of go through the basics. So mind-body medicine is actually the original form of how our bodies were meant to heal. If you even look back to like Hippocrates, he's known as like the he's the Greek physician, and he's known as like the father of medicine, right? Like that's what he's referred to. He even has a quote saying that, I don't know the exact quote, I don't think I have it written down here, but our innate healing ability is within us. And he says the doctors of the future won't use any medication, they'll use, food, like that kind of stuff. Like he knows that he knew that our bodies were created to heal themselves. The issue came in when modern medicine started to take a turn. And I don't know if you've ever heard of John D. Rockefeller, but he's the man who paid, the medical schools. He was like, here, use this petroleum that I just happened to produce to make these medications, and then have these textbooks to teach your students how to use these medications. And that's where we kind of shifted from looking at the whole person when you're treating an illness versus, oh, what's the symptom, what's the organ system, and what pill can I give to get rid of that symptom? That's kind of where our medical system shifted. So, and in all reality, this the holistic way of healing, which is seen as alternative now, is actually the original way it was intended to be. And you can kind of see that when you look back, like even with Eastern medicine, Chinese medicine, like all those other medical models that still to this day use kind of a mind, body, spirit approach, that those date way farther back than our, medical system does here in the United States. So I know people have mixed feelings about these kind of holistic and alternative ways of healing, but I mean, as you can see, even on this wall over here, like mindset, like that's a part of it. And for some people, that's the missing piece because it's not generally talked about, when you go to a neurologist or a pain specialist or whatever specialist you're seeing. Not that they can't be helpful and not that medication can't be helpful, because it totally can. But when you're talking about chronic illness and disease, there's generally a piece that's been missed or forgotten about or just not even talked about. And that's this piece. I don't know if you've heard of the polyvagal theory, but the polyvagal theory emphasizes the role of the autonomic nervous system. So the part of your nervous system that you don't have like conscious control of, your breathing, your blood flow, all that stuff. If that's out of whack and dysregulated, that can cause a lot of issues as well. There was actually this really cool piece of information that just happens to be about rheumatoid arthritis. But back in 1964, there was actually a psychiatrist named George Solomon who noticed that people with rheumatoid arthritis got worse when they were depressed. And he began to investigate the impact that emotions had on inflammation in the body. And we all know that inflammation is another big root cause of a lot of illness. And this new field was called psychoneuroimmunology. So he kind of pioneered that. And then there was another study done on of 86 women that had late stage cancer. Half of them received just standard medical care. The other half received the same care plus weekly support sessions. And they found that the people that did the medical care with the support sessions had they lived twice as long as the other group of women that did not receive that support. So that just again goes to show you the huge impact of just even having that support when you're going through some sort of illness. And then another physician I want to highlight, his name is Dr. Gabor Mate, and he is a Canadian physician. He's been in family practice since like 1977, and he was in practice for 20 years. And he started to see this, he actually started studying addiction, but then saw that he was seeing this in a lot of chronic illness and disease, kind of the same root factors and causes with emotions and past traumatic events that people hadn't processed through yet and that were still causing issues. So are the videos up on here? So I just go next?
Yeah.
Okay, this is fancy. I don't know. Okay. There's a short, like a minute and a half clip I want to play of him speaking about this type of stuff.
There'd be no point to this conversation unless there was some way out of it. And the good news is that it's possible for the human brain to develop even later on in life. And that's called neuroplasticity, the capacity of the nervous system to develop new circuits in response to new experiences. So the question in the treatment of addiction or any other mental health problem is not just how do we control the symptoms, but what conditions do we have to establish under which people can develop new circuitry for the human brain to develop even later on in life. And that's called neuroplasticity, the capacity of the nervous system to develop new circuits in response to new experiences. So the question in the treatment of addiction, there'll be no point to this conversation there'll be no point to this conversation unless there was some way out of it. And the good news is that it's possible.
Okay, the blue light's on, so I think that's what happened. Okay, so basically what he's saying is that, hold on, I have the notes. So all his work stems from the knowledge that all of our experiences, especially as a child, throughout our life, shape our brain in a certain way, right? If you've heard of the word neural pathways, our brain is shaped by all these experiences, a lot of times traumatic experiences or experiences that our brain perceives as traumatic. And then we develop these ways of coping to keep us safe in that moment. So whatever that experience may be. Well, when we get to our adult life, those coping mechanisms turn into unhealthy ways or ways that our brain thinks is trying to keep us safe, but it's actually doing the opposite. And so it's creating our nervous systems to be in a constant state of fight or flight. We're constantly trying to look for the danger. We're constantly trying to solve problems, anxiety, worry, stuff like that. And all of that affects our bodies on a cellular level. But what he's saying is that the good news is you can actually rewire those pathways and teach your brain that that's not the way that you have to respond, or that's not the only way that there is to react in situations. Even though you may not be consciously, it could be your subconscious brain. You're not aware that you have these survival mechanisms in place. So that's kind of what his work is all about. There was another video, but I'll just give you a little bit of background. There's another doctor. She was actually an ER physician, which is why when I was going through my healing journey and trying to figure out how to heal, I connected with her story because she was an ER physician and I was an ER nurse. So I kind of knew what that environment was like. And it's very, medical. It's very, every organ system is separated on its own. But she now works in the field of mind-body medicine. And I'm just going to read her bio just really quickly so you can get an idea of kind of the work that she does. And I think my other reason of kind of bringing up all these physicians and people in this field of work is almost to give it some sort of validity and just to let you guys know that there's a lot of really intelligent, really amazing doctors and physicians and people out there that have gone through traditional medical school or done the traditional route, and they see that there's this huge gap that's not being addressed, and they see people suffering and they see people having these issues, and people like me were out there like, there's another way. There's other things you can be doing. Again, not that medication or these treatments don't work or can't help you ease symptoms temporarily, but most of them are Band-Aids, and most of them are going to give you temporary relief, if anything, but what could actually be at the core. So her name is Dr. Kim Duramo, and she said, I've always been a highly sensitive and intuitive person, able to read and feel energy and aware what's going on beneath the surface. Growing up, I was deeply aware of what was going inside my body and could witness how my thoughts immediately impacted my body and those people around me. I was fascinated with mind-body medicine and spirituality and started to study these with passion. I knew at a young age I was here to be a doctor, share my awareness that our thoughts create our reality, our emotions directly affect our cells, and our bodies can heal from within. I later attended osteopathic medical school and went on to become a board-certified emergency medicine physician. As a doctor who was so highly empathetic and energy sensitive, it was easy for me to tune in and quickly see exactly what was limiting my patient's health and keeping disease in place. Working in the emergency room for years, I was amazed at how universal this was. All of the patients I saw with chronic illness had a component of emotional and mental energies keeping their disease state in place. And I can say the same thing now, working in my practice for 2 years. No matter what it is that the person is coming to me with, even if it's like a life issue, a relationship issue, even if it's not specifically chronic pain or illness, there's always some root of emotion that hasn't been addressed, that's being suppressed, an event that happened in their past that they haven't processed through completely, and then that energy is then being stored in their tissues. Because that's one of the biggest points I want to leave you all with today. If you leave here with nothing else, just remember that emotions don't just stay in your brain. They're not just stored here. They are physically stored in your tissues, in your body, in your organs. And again, if this is your first time hearing about all this, and this sounds like way out of left field, scientists can take a cell of a human body, even like an atom, and see that it's not still, it's moving, it's vibrating on a certain frequency. It is energy. There is energy flowing through us constantly. And our mind and our brain and our thoughts affect our cells energetically constantly, whether we're consciously aware of it or not. So a lot of the issue again comes in when our subconscious brain is running the show and we're not actually aware that we're repressing a certain emotion, or this event that happened back then, I didn't process that properly and I'm still hanging on to that energy. And it's still, for me, I was a chronic people pleaser. I didn't want to say no. I wanted everyone to be happy with me. I wanted to take care of everyone else. I was constantly saying yes, constantly giving to everyone else. But then what did that leave me? Not a whole lot. I was hanging on by a thread. I had a lot of issues from my past with my family that I didn't even realize. I was not consciously aware that I even had problems with that. And so working through all of that and incorporating a lot of the mind-body techniques that I now help my clients incorporate into their daily lives, we can start to not only process through all the negative energies and events that have happened, but we can start to rewire those neural pathways in a new way, so that when you do experience, sometimes it's called a trigger, when you do experience that, your brain doesn't immediately go to survival mode. It doesn't immediately go to, oh, well, I know what this is. This has happened in the past. Now I have to go on this pathway. We can kind of shift gears and rewire. So that was, of course, a tangent, but all important. It's all part of the process. So yeah, how am I doing on time? What time do you want me to wrap up by? Okay. I just want to make sure I touch on all the main points, and then we will go through that meditation, that mindfulness, and then I do want to leave room for questions or comments or anything. That is the other note I was going to make. Sometimes my 1-year-old does not do the best when I'm not home. She's a very high needs baby and needs mommy. So if I am not here at the end of class, if you see me run off and take off, it's not because I don't want to be here and hang out and chat afterwards. It's because of my baby at home. But I do want to leave a little room before I step down here so you guys can ask questions or whatnot. So let me just make sure I hit on all the main points. I think I did. Okay. So let me get out my, if I have background music on my phone, like down here, is it gonna, okay. Personally, when I sit down, so 3 of the main methods that I started with when I was just entering this world was journaling, a therapeutic journaling technique called journal speak, meditation. I'm sure everyone's heard of some meditation. Sometimes it's called mindfulness. And then EFT tapping is the other one. I won't get into that one tonight. That one's a little bit more in depth. But this hits on one of those 3 main mind body tools that allows you to kind of try to tap into that subconscious brain. If you've never meditated before, this is your first time. If you're fidgety, your mind wanders, it's totally fine. This is just an invitation to just kind of slow down because we live in a very, very fast-paced world that's not conducive to healing. So when we're constantly on the go, we're constantly running to the next thing, worried about the next thing, our bodies actually can't heal the way they're supposed to because we're just moving too fast. So this is just an invitation to just slow down. I'm going to put on a little background music because that's how I prefer to do my meditations usually. So let me get that going. And then I will proceed. Okay. So begin by finding a comfortable seated position with your feet grounded on the floor, whatever feels most natural and relaxing for you. Close your eyes gently and take a few deep breaths. Close your eyes gently and take a few deep breaths, inhaling through your nose and exhaling fully through your mouth or nose. If your mind starts to wander, just know that's completely normal. Our brain's job is to think, so it's just trying to do its job. Anytime you catch yourself thinking about something else, just thank your mind for doing its job and bring your attention back to your breath. Let your breath become your anchor, grounding you in the present moment. Or if it helps, visualize each thought as a cloud, allowing the cloud to gently drift away as soon as you become aware of the thought. Now bring your attention to your body. We're going to do a quick body scan. We're going to start at the top of our head and bring it down to our feet. I want you to notice any sensations or areas of discomfort that you may be experiencing. Allow yourself to fully acknowledge and accept these sensations without judgment. Know that it's okay to feel whatever you're feeling in this moment. So bring your attention to the top of your head, down to your neck and your shoulders, down both of your arms, now to your chest, your belly, your hips, both legs, and finally your feet and toes. Now I want you to bring your attention to the pain or discomfort that you're currently experiencing. Our instinct with pain is to resist it, to tense up and try to shield ourselves from it. But today, I want you to welcome it, invite it to make its presence known, to even increase in intensity if that's what it needs to do. As you sit with this pain, I just want to remind you that this is your body's way of communicating with you. So let's take a moment to thank our body for loving us enough to communicate to us in this way. As you surrender to your pain, allow yourself to feel any emotions that may arise. It's okay to feel sadness, frustration, or even anger. Simply observe these emotions without attachment, letting them flow through you like waves in the ocean. Now I'd like to take some time to send some healing energy to those areas of pain or discomfort. So with each breath in, imagine sending soothing waves of relaxation to the area of pain. Visualize each breath as a gentle wave of comfort, washing over the sensation of discomfort, easing its grip on your body. Now gently repeat the following affirmations to yourself, either out loud or in your head. I acknowledge my pain and I allow myself to feel it fully. I am worthy of love and compassion, even in my moments of struggle. I surrender to the healing power of acceptance and forgiveness. I release any resistance or tension in my body, allowing peace to flow through me. I am strong and resilient, capable of overcoming any challenge that comes my way. As you continue to breathe deeply, imagine yourself surrounded by a warm, comforting light. This light represents love, compassion, and acceptance. With each inhale, feel this light filling you up, nourishing every cell of your being with warmth and kindness. Lastly, I want you to take one hand to your heart, one hand on your belly, and repeat in your mind or out loud, I am safe and I am loved. Now take a few more deep breaths. Gradually bring your awareness back to the present moment. If it feels good for you, you can wiggle your fingers and toes, gently stretch your body. And whenever you're ready, you can slowly open your eyes. I want you guys to remember that this practice of surrendering to your pain is a journey, and it's okay to revisit it whenever you need to. Be gentle with yourself and know you're not alone in your struggles, and you are worthy of compassion, love, and healing. Okay. So that is just a short example of what it looks like to slow down and take time to talk to your body, to put your hands on your own body. Because the reason why I entitled my workshop Embrace the Pain is that a lot of times we feel like we're fighting pain. And I know for me, that's what it felt like a lot of the time. Like, why is this happening to me? Why am I struggling like this? Like, I felt like it was a constant fight, but that actually creates the emotions and the energy that are counteractive to healing. So we almost have to learn how to embrace it. And I know it's so hard and it sounds weird and crazy, but thank your pain, thank your body, and almost partner with your body. It's not you against your body, it's you and your body against whatever it is that's creating the environment that is allowing you to have these symptoms or pain or whatever it is. So, yes, I want to open it up now to questions or comments or anything you guys have for me.
I might make this comment. I've been doing something similar to this with spiritual for about 32 years.
Mm.
So you start talking about the light,
Yeah.
and have people go back in their memory like you did
Yeah.
to the dark place in their life where spiritually something happened.
Yeah.
And then we take it to the light, which happened to be the cross.
Yeah.
And the other thing you mentioned about, how did you say it? Anyway, I see that those root problems, and the main thing I think it's all about for me is I see a lot of people with the spirit of bitterness.
Yeah.
And so that
Yeah.
creates all these monsters,
Yes.
physically, emotionally,
Yeah.
and spiritually. So I
Absolutely.
have a chart that has about 300 different things that they can do with it.
Totally. And I come from a Christian perspective. I am a Christian. I when I speak about energy and spirit and higher power, that for me is God, but I do acknowledge that not everyone feels that way. So for me, I say a prayer before every one of my sessions that I want the Holy Spirit to be working through me and allow healing and give me the right words to say, the right, know when to listen, know when to speak, all that stuff. So yes, totally.
I would say use it in reference to God, because
Yeah.
no other part of it except the part of God.
Yeah.
So if I am offensive to somebody, maybe the spirit of God will change.
Yeah, totally. Yeah, absolutely. Anyone else have questions or?
Well, I think part of it you're talking about, like yourself, part of a ministry that's called One Whole Heart.
Mhm.
Is the heart.
Yeah,
The offensive,
Right.
the trauma,
right,
things that happen when we don't deal with them.
right.
Many times we just
That's our
brush over
survival
the trauma
mechanism.
like it was just an everyday
Exactly.
thing, but it's not an everyday
Yeah.
thing.
Totally.
Even for a little child, you can see the
Yeah.
trauma being before.
Yeah.
A few times, and you know that they're traumatized.
Yeah.
They don't even want to come here.
Yeah. Yeah.
So, and bitterness is a big thing.
Yeah.
It will kill you.
Yes.
Bitterness is hard. And it's a hard issue.
Yeah.
Actually, many times we're not dealing with the things that really wound us.
Right. And
And
then,
our body takes up the
yes. Yeah, our body's gonna communicate that to us. And a lot of times it does present as some sort of chronic pain or symptom or whatever it is. But you don't hear about this when you go to a doctor or go to, you don't hear about this piece of it. And a lot of times this is the key. This is the key for me and for a lot of people. And I don't ever want people to think I'm saying, well, this is all in your head and blah, 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 whatever. It's not in your head, but the answer isn't in your body. And God created us in this way to heal. This is how He created us. This is how He created our bodies. And so to overlook that and to not, pay any attention to our emotions or to what may have happened to us in the past, that's, it's a huge missing piece for a lot of people with whatever they're struggling with.
I've been growing in my faith a lot. One of the big things I've been noticing is, well, to embrace the truth in my life and live that out loud and on purpose. But the other thing is to think about this, because the majority of the thoughts that don't come from God are not good.
Yes.
They take you down and drag you down.
Yeah.
That has been one of the things that's been helping me, because even like I found out today, I got up in my chair, I went from home, and I went to get in and I twisted around and my knee had been bothering me. And it had been getting better, and it started to twist, and I just refused it. I just said, no, God, I can't trust your truth.
Yeah.
And it's healed.
Totally. I have experienced
It went away.
something
Just
so
like that.
similar. Yes. Totally.
Rebuked it and
Yes.
told it to go away, and it went
Yeah.
away.
Isn't that so? I love stories like that, because I have also experienced just super short story of when I was chronically ill and in pain, I would do something similar, like turn as I was like backing out of the driveway, and I would feel a twinge in my neck and I would spiral. I'm going to be in so much pain. My neck's going to hurt. Like I would go down that spiral, and that was my reality. Our thoughts create our reality. And so then after I've done a lot of this healing work and I've, made a lot of progress, I think it was after I had my first baby, I was about to go back to work, working in the operating room, and I fell down the stairs super hard to the point where I almost blacked out. I was in so much pain. I landed straight on my tailbone, and I was convinced I'd broke it, but I immediately went, I'm going to be okay. I know my body knows how to heal. I'm going to be okay. I would stop and take deep breaths, relax my body, not let my mind take me down that road. And I hardly had any pain from that injury. I mean, barely anything. And I'm like, that was just almost solidified that, like, okay, yes, this is, yes, absolutely.
We call them racing thoughts.
Yeah.
When you ride down the road and all these thoughts start coming at you.
Yeah.
Where did you all come from?
Right. I even talked myself out of a really bad headache once. Like, thoughts were taking me, like, I felt the headache coming on, and I literally just like took some deep breaths, dropped into my body, just started praying, like, and yeah, it's amazing what can happen when you learn to, like you said, kind of take your thoughts captive and all the things.
That's what I've heard that for years. And I've been doing a Bible study and then part of the ministry in Arizona, and so I've just been learning a lot. And it's like, okay, I'm just go for it.
Yeah.
Like, I don't know what holds me back.
Right.
And, just thought of starting something. But
Yeah.
it's like, okay, when it comes up, I'm gonna do that. Whatever.
Yeah.
No, I refuse to do that.
Yeah. Yeah.
I refuse to accept that.
Mhm.
That is not true.
Yeah. Absolutely.
And it's just even in the last week, things have been changing.
Oh, I love that. Yeah. That's amazing.
Capturing every thought and making it a
Yeah.
meaning.
Yeah. Absolutely.
We got a lot more to cover tonight.
Yeah, for sure.
Thank you.
Okay.
Taylor, round this one.
All I have.
You have a card?
I do. I will grab my cards. And I sent around that form just to get contact information. I have that recorded. I can send that out. And then I also offer, a free 60-minute coaching session for people to experience what I do in that setting. So I'd love to offer that to anyone here and listening and whatnot. So yeah.
Okay. So now we're going to talk about arthritis, what it is. And as you can see from the slide, there's more than 100 different types of arthritis. We're going to narrow this down a lot. So to make it simple, we have three basics. We have degenerative arthritis, we have rheumatoid or autoimmune disease, and then we have metabolic arthritis. There's different forms of that underneath each of those categories. Again, degenerative arthritis, by far the most common. It is also called osteoarthritis. If somebody tells you they have arthritis, this is probably what they have. It's also called the wear and tear disease. It's what comes with old age, quote unquote, old age. Although we see degenerative arthritis in younger people, we see it more commonly in older adults. Autoimmune arthritis, again, the hallmark autoimmune is rheumatoid arthritis. As you can see, I've got a couple others listed there. Lupus, ankylosing spondylitis, and the newer term is axial spondyloarthritis. I hadn't heard that one before. And then psoriatic arthritis. Those are autoimmune diseases. We'll talk more about these specifically. And then metabolic arthritis. Everybody's probably heard of gout. And that is a type of arthritis as well. The word arthritis, what does that mean? Does anybody know? Inflammation of the joint. That's all it means. And something, either a degenerative process, an autoimmune process, or a metabolic process, is leading to that inflammatory process. Okay. So this one kind of talks about the breakdown. More than 47 million Americans have arthritis. Again, as you can see, 30.8 million, or almost 2/3, have osteoarthritis, which again is why I said it is the most common. Here, 8.3 million is the gout or the metabolic arthritis. 4 million Sjogren's. Rheumatoid is 1.3. If I'm reading this, spondyloarthropathies, 2.1 million. Rheumatoid, 1.3. Idiopathic arthritis. So these are your autoimmune diseases. All of these, with the gout and then the osteo. So that just kind of gives you an idea of how it's broken down. So what is osteoarthritis and what are the risk factors? Well, I said it's more common the older you get, so age is a big risk factor. Females tend to have more arthritis than males, and actually most of these are more common in women than men. Obesity, again, it's the wear and tear. So the more stress and strain we put on our joints, the more they're going to wear out. Joint injuries, so the athletes, those repetitive motion, people who do the same job over and over and over again, get those repetitive motion type of injuries. Genetics does have a role in osteoarthritis. And then, like I said, joint overuse or repetitive motion. So what's going on in osteoarthritis? This is your normal healthy knee. We've got nice smooth cartilage. The cartilage is kind of that end cap on the bones that allow them to glide over each other. The meniscus, again, that's that cushion that helps protect the knee or any of our joints, most of our joints, and helps keep them in the right spacing and everything's working well. Well, something gets off, and it could be, again, I'm overweight, I'm putting more pressure on my knees, I am aging, I've been doing the same job over and over. Any of these risk factors starts to erode away at this cartilage. The meniscus may or may not get worn out as well. My body is going to try to create new bone to replace, to help prevent the pain. And by getting these, and you probably heard the word bone spurs or osteophytes, the bone spurs build up to try to prevent that joint from moving, because if that joint doesn't move, it's not going to hurt, because it hurts when it moves. Okay, that's the basis behind osteoarthritis. So what do we do for osteoarthritis? We take anti-inflammatories. That's usually what's prescribed. Lose weight, exercise more. But doc, I can't exercise because it hurts when I move. Well, go walk 10,000 steps anyway. Well, that doesn't compute. Try to do some non-weight bearing exercises. So pools, bicycling, those types of things. So you can still move the joints, but you're not weight bearing. Sometimes that'll help as well. If we can eliminate some of this misalignment in the beginning, that we're going to be better off. We won't develop as severe of arthritis. Okay. The autoimmune diseases, again, rheumatoid being probably the hallmark one, the one that we know the most about or hear the most about. What is an autoimmune disease?
When your immune system actually works against you.
Your immune system is overreacting. It's called a hypersensitivity reaction. My body is hypersensitive to something, and we're just not really sure what that something is. Then my body creates the inflammation, and the inflammation is, again, trying to be a protective mechanism, but it actually leads to damage. Again, our normal knee, we've got the capsule, we've got the synovium, which is the fluid in there. Again, your nice healthy cartilage and your bone. What happens? We get that inflammatory process coming. With inflammation comes redness, comes warmth, comes swelling, comes pain, and disuse. Again, as we get more swelling in here, we get those white blood cells coming in. They're going to start eroding away this cartilage because your body's thinking it's trying to fix this inflammation, and that bad thing, that invader, it's got to be in there somewhere. So we're going to erode away at the tissue lining. Unfortunately, what are we doing? We're making the knee or whatever the joint is that much worse.
Because it's been damaged.
In a test tube or a petri dish. We can try to restore it so it doesn't break down, but you're not going to regrow it to its normal, its previous. But to take the collagens, those types of things to help provide your body with the building blocks, but it works very, very slowly. Yeah. So risk factors, again, genetics, smoking status, exposure to toxins, certain infections, biological sex. Again, I said females are much more likely to have rheumatoid arthritis, age. There is such a thing as juvenile onset rheumatoid. And actually, most of these autoimmune diseases tend to be diagnosed in the 15 to 25-year-old age group. Just from a personal standpoint, my niece was diagnosed with rheumatoid arthritis about, I think she was 23 maybe when she was diagnosed. About a year prior to that, my daughter was 22. She was diagnosed not with rheumatoid, she was diagnosed with ankylosing spondylitis, which is, if you remember, was this one, ankylosing spondylitis, also an autoimmune disease process. Okay. So again, it tends to hit earlier in life and more common in women. The ankylosing spondylitis isn't. That's actually more common in men, but whatever. You know, it doesn't, nothing hard and fast that it's only in guys. Age, like I said, and weight. Okay. So what do we do with rheumatoid arthritis? We give you something to stop your immune system from reacting, like an immune suppressor. We'll give you a steroid. What are steroids going to do? Well, yes, that they do. That's a bad side effect of them. They suppress your immune system, so your immune system can't do this. They also make you more likely to get sick. They decrease the inflammation, yeah, but a lot of times the inflammation has a good purpose too. In this instance, with rheumatoid or the autoimmune diseases, that inflammation is detrimental, and that's what's causing the problems. Okay, so again, medicine, try to suppress the immune system. Psoriatic arthritis, again, one of those autoimmune diseases. Lupus, some of you have probably heard of lupus. Here's just the signs and symptoms of lupus. I do want to point out, and I don't remember, here on this slide, osteoarthritis versus rheumatoid arthritis. Osteoarthritis only affects your joints, where rheumatoid arthritis is actually what we call systemic. It affects your whole entire body. So you can certainly have a low-grade fever, fatigue, malaise, or just kind of that sleepy drowsiness going on. I just kind of don't feel good. I don't feel like I got hit by a semi, but maybe I got hit by a VW bug or something like that. Osteo, more common. This says base of the thumb. Definitely hips, knees, shoulders, those bigger weight-bearing bone joints are going to be more affected by osteoarthritis. Rheumatoid starts in the smaller joints, typically hands, feet is where we see that more commonly. And then it can certainly go. Another, does it say? Yep. Affects joints on both sides of the body. Rheumatoid is bilateral. What happens on the right happens on the left. Osteo, what happens on the right stays on the right. Typically. I mean, you know, depends on what was the imbalance that caused the degenerative changes, but typically it's one-sided. Rheumatoid morning stiffness commonly lasts more than 30 minutes. Osteo stiffness that lasts less than 30 minutes as you get up and you get going. You kind of loosen things up, limber things up, and you're not quite so sore. Treatment, again, mainly symptom relief. Here, treatment with pain relief and medication to reduce inflammation, like we talked about. And then the risk factors we've already talked about. Okay.
You said psoriasis, the psoriatic.
Psoriatic arthritis.
Yeah,
Yep.
psoriatic. Is that, now I hear psoriasis, is that to be a symptom of that?
Not everybody with psoriasis will develop psoriatic arthritis, but people with psoriatic arthritis have psoriasis. Okay. So it's a additional complication of psoriasis, again, which is an autoimmune disease. Okay. And then metabolic gout. Gout is an excess of uric acid crystals that your body's not able to excrete. When I was teaching and still when I talk to people about gout, I call it the disease of the kings. When they first diagnosed or started identifying it, it was only, I always think of old King Cole was a merry old soul, this big old fat dude sitting on his throne. People would bring him the finest wine and the best fatted calves, right, for his meals. Well, guess what? That's what causes gout. The higher the fat content in your diet and the alcohol. Okay. Yep. Now you don't have to be the richest king to get the alcohol or the fatty meats. So we see it a lot more. So as it says, symptoms, inflammation, redness, temperature increasing. Again, that uric acid is a waste product of protein metabolism. And if your body can't handle it, it builds up. It likes to, the uric acid itself will crystallize in colder temperatures. That's why it's more common in your feet, because that blood in your feet is as cold as it's going to get, because it's as farthest from your heart as that blood can flow. So that's why we see a lot more gout flare-ups in the feet than we do anywhere else. Now, you can see them in the hands. You can see them in other joints. Tophi, I don't know if it talks about tophi, it should. Tophi are the actual lumps that you'll see on the outside. Those tophi can actually collect on the inside of your blood vessels, inside of your organs. So it's not just about my foot hurts. And when my dad had his first gout attack, they were on vacation in Louisiana. And he thought he got bit by fire ants because that's how bad it hurt. They cut their vacation short, came home, and he was diagnosed with gout. So that was just the intensity of his gout. And I have taken care of many patients who I was literally at their bedside giving IV morphine because the pain was so intense for these individuals. They couldn't tolerate the sheet on the bed. We had to put a big frame up over the bed so that we could have them covered, but didn't have any pressure on their feet. We don't do that now. You can't hardly even be admitted for a gout attack now. They give you drugs, again, to reduce the uric acid, to make your body excrete the uric acid better. And most people can get by without being hospitalized on IV morphine. But I've been there, done that. So just to kind of tell you, and again, those tophi, or those little crystals, can form on the inside of organs as well and lead to all kinds of problems.
That helps with blood clots? I mean, not help, but create blood clotting problems and things like that?
Not really. More what the tophi are going to do is just lead to an obstruction as opposed to a blood clot, a blockage. You know, I haven't actually seen them, but I've seen pictures or heard of people who had tophi on the valves of their heart. Obviously, your heart isn't going to function if you've got this big uric acid crystal collected on the valve of your heart, right? It's not going to function. It's not going to open and close like it's supposed to.
Would you see symptoms before it got that far?
I would hope so, yeah.
So you wouldn't just see it.
No, you should have had all the other gout signs and symptoms first, yeah. Yeah. Right. So what do? I mean, you look at what foods you eat. I had one individual who said I can get away with eating 6 ounces of a steak, but if I try to eat 8, I have a gout attack. You know, he was very specific. He had it narrowed down. Most people aren't that specific. You know, they say, well, I know I need to avoid sausage, or I need to avoid something that's cured, or some alcohols, you know, depends on what it is that leads to the increase in uric acid levels. So, okay. Questions?
All right.
I've been teaching this stuff for about 35 years, so.
All right, buckle your seatbelts, guys. We gotta crank through this. So everybody stand up, unbuckle, stand up, stretch out a little bit, get some movement. Yeah, get some movement. Stretch, reach to the sky, all the way up, then over to the side, then the other side. Yep. Good. Little twisting, left and right. All right. Do a knee raise. All right. Do a couple calf toe raises. There you go. All right. Have a seat. Now buckle up. Okay. So 3 hours left. We're going to do that in the next 30 minutes. Okay. So Cheryl hit it hard. You know, what does arthritis mean? It means joint inflammation. And so when we're talking about how do we address the cause of this stuff, we have to go back to what's causing the inflammation. So that's what we're going to unbuckle here. Now, Taylor unpacked the mindset of this beautifully, so I'm not going to go as deep into that as we can. I'll just kind of brush over that, but that was awesome. But chronic inflammation indicates stressors. If you've got inflammation, if you've got pain in your joints, it means that something's going wrong through one of our 5 essentials, right? What we have up here on the wall. So core chiropractic, nutrition, mindset, fitness, and toxicity. So number one biggest inflammatory stressor is going to be the standard American diet. It's super inflammatory. There's not a healthy way to eat the standard American diet because it is so broken. If you are stuck, and I know some people are, that they choose to live in an assisted living facility or a retirement facility and they get on the meal plan, guess what? You're shot. You just shot yourself in the foot. And you're paying $1,000 a month or $2,000 a month to stay there. It's personally, yeah, or per week, depending on where you're going, I'm staying as far away from that as possible. I want full control over my food and my food sourcing. So one of the biggest things with this is hidden sugars. You know, if you go shopping and you turn that, item around and you look at what's in there, if it's in the inside aisles, there's probably at least 5 of these listed on the ingredients if it's coming from an inside aisle in the grocery store. Check it next time. Do a test. Run through the grocery store next time you got 30 minutes and just kind of look and see how much, or just your cabinet if you stuck some stuff in there. But just, this isn't even the complete list. This is just what we were able to come up with 2 years ago. So artificial sweeteners, also part of the problem, just as inflammatory. And we talked about this a lot with our blood sugar and diabetes workshop that we did a couple months back. But artificial sweeteners, they actually not only will create the same insulin response when the sweetness hits your mouth, but it also kills your microbiome. And so that's going to make things like autoimmune type arthritis that much worse. Secondly, we're going to have your sedentary lifestyle. And this is another thing. Americans, 93% of us don't get enough exercise. So that's probably just about everybody here. I'm not gonna say it definitively, but probably we're sitting too much. Probably we're not getting up and moving around. And in fact, even just sitting, Time Magazine came out with a study, sitting is the new smoking. Sitting for an hour at a time is more detrimental to your health than smoking a single cigarette. So if you are in that armchair watching a movie for 3 hours, you just smoked 3 cigarettes for its effect on your health. Yes, yes. I will write you a doctor's note that says you need to get up every 30 to 45 minutes. And that's my recommendation, especially if you're working from home. Set a timer on your phone. Every 30 to 45 minutes, it should beep. You should get up, go get a drink of water. And if you need to, go back and sit down, right? If that's what you need to do, you go back and sit down. But get up and move. You got to get up and move. And we have a genetic requirement for exercise. Mindset stressors. And she hit this. Anxiety, stress, poor sleep. Absolutely, you need to be addressing all of those things. We'll talk a little bit more about that. But toxic exposure, this was last month's class, was toxicity and how many different sources of toxicity we get. Some of the biggest ones, well, we're putting on our clothes that we're wearing 100% of the day, unless you're sleeping naked, and then you probably got sheets on, right? All right, bathroom, what you're putting on your face and skin, you know, your bedroom, what's in the air in the bedroom, what you've got on your blankets and sheets, the kitchen, what you're cooking in, what you're putting in your ingredients, and then your living room. What are you cleaning with in there? What are you putting to make it smell better? You know, those things all matter there. And then number 5, and probably the biggest one, and not just because I'm a chiropractor, but because I know how arthritis works, subluxation is a stressor. So what is subluxation? I know I get this question. What is that? Subluxation, it means a condition of less light. That's, if you break it down in the Greek, sub, less, lux, light, Asian condition of. So it's literally a condition of less light. It is a misalignment of the spine that disrupts the neural signals. So when she was talking about the polyvagal theory, one of the biggest subluxations that we see is right around the vagus nerve at the top of the brainstem. And there's a lot of chiropractors that will only work with the top couple of bones here because they understand the impact of the vagus nerve, especially when it comes to inflammation. If that bone is off even slightly and it disrupts your vagus nerve, it'll disrupt the signals going through that vagus nerve. And that blue nerve there, where does that go? Yeah, the whole body. If that is inflamed, if that is irritated, if that is off at all, it'll set everything on fire. And there was actually research done a few years ago. So actually while I was in school, so now we're talking about 15 years ago. But for rheumatoid arthritis patients and cancer patients, they were inserting electromagnets inside their vagus nerve and giving them just a magnet to rub over it every day to stimulate their vagus nerve, and they were healing their cancers and they were healing their rheumatoid arthritis. Guess what we need to do to stimulate the vagus nerve? Get adjusted. We don't need to go in and get a surgical implant into that. We just need to make sure our atlas is lined up to address that inflammation. So that is a huge part. If you miss that part and you do everything else, just like if we miss the meditation or the stress part or the anxiety part, or if we miss the nutrition part, guess what? It could all still fall apart. So we need to be constantly looking at this. And I say this in every single workshop. The thing that we're missing over here is the thing that could kill us. So if one of these things is resonating with you, this is the thing that you need to take away from tonight, right? So stress is everywhere. Where do I start? How do I address inflammation? I say start with the central nervous system. And that can be psychologically, that can be neurologically, that can be chiropractically, that can be nutritionally. But the nervous system is what controls everything. And we talk about that innate intelligence inside your body. When you were formed in your mother's womb, the very first thing that came was your brain and spinal cord. And off of that, every organ and tissue grew like trees. And if you were to melt away every other cell and tissue in your body, except for your nervous system, you would still look like you. You would still look like you had all your organs. That's how intricately controlled your entire body is. So what we see here, branching out there, that's not what your nervous system looks like. That's what your nervous system looks like. That's what your nervous system looks like. That's what your nervous system looks like, is what I see right there. It controls absolutely everything. And so we have to allow, number one, we have to recognize that healing takes time, right? I bet you didn't just journal once and the pain went away. Right? This took a while. And guess how many patients I see where I do that perfect atlas adjustment and the pain goes away completely? Like none. Guess how many patients I've given the perfect meal to? Perfect meal plan, they followed it immediately and then immediately the pain went away. None. It doesn't happen because healing takes time. And so we have to recognize this. Where you're at in your healing journey depends on where you've been in the path that you've traveled down to get to where you're at today. And so we have to recognize that. So the nervous system controls everything. And so when we're looking at that inflammation, we have to address the most obvious thing. Is the spine putting pressure on the nervous system at any point? It can be at the atlas, but where else can it disrupt the nervous system that can create inflammation? Literally everywhere. And in fact, when we break it down to every joint in the body, osteoarthritis, Cheryl unpacked this beautifully. Any joint that's out of alignment at all, any abnormal wear and tear, even if you have a stronger outside of your leg than the inside of your leg, stronger front side of your core than the back side of your core, it's going to wear those joints out abnormally. A joint that's out of position even slightly wears out at a rate of 7% per year. So it's really important that those joints are in alignment, that our muscles are balanced, that we're doing this stuff. So how do we do that? Well, chiropractic. That's where you have to have somebody like me come alongside you and make sure that those joints are in position. Find those things. And so how do you know when you're out? Unfortunately, pain is usually 20 years down the road with this. Pain is there to tell us something's going wrong, but you have to get through your day and you have to do your stuff. And usually it's been going on, the thing that's going on is going on so long that actually it's 2 decades before you feel it. So we need to be doing the tests, we need to be taking the x-rays, we need to be looking at these things, you need to be taking your LRQs at your progress evaluation, the lifestyle risk questionnaires, to continue to identify where are those stressors that are undermining our attempts to stay in some cases, get healthy, right? So stay ahead of that. Secondly here, nutrition really, really matters with this. If you eat junk, what are you? Junk. If you eat healthy, what are you? Healthy, at least from a cellular level. You're replacing yourself at a cellular level completely every 10 to 20 years. Your heart, every 5 to 10 years. Your stomach lining, every 3 days. And so if I eat a bag of jelly beans for the next 3 days, how's my stomach lining going to be 3 days from now? It's going to be awful. It's going to be really bad. So when we're looking at the healing diet, when we're talking about pain, when we're talking about arthritis, if you're experiencing pain, if you're experiencing arthritis, this is a non-negotiable. Number one, we have to curb our carbs. The only carbohydrates that we should be eating should be coming in the form of whole fruits and vegetables. And really, even with fruits, we have to recognize that the fruits that we're eating today are not the fruits that were in the Garden of Eden. The fruits that we're eating today have been so hybridized, let alone genetically modified, hybridized, that Adam and Eve wouldn't even recognize the apples and oranges and bananas and pears and berries that we're eating anymore. And so even fruit, it sounds like it's a healthy thing, we should be cutting back on. We should be looking to make sure we're not overdoing the sweets.
Are there anything that hasn't been fully hybridized?
Probably not. We're 6,000 years away from creation, right?
Even
At least. Yeah. Yeah. No, everything's been changed. And some of it, it's because we learned how to make it better, but a lot of it has just been to make it taste better, right? We want it to be sweeter. We want it to be bigger. We want it to have more meat. So that's where most of the farming practices have gone. Secondly, we've got to fix our fats. We look at the standard American diet, we have an omega-3 fatty acid ratio of 17 to 1. The ideal fatty acid ratio is 2 to 1 or 1 to 1. And so we have to get away from that. So fix your fats, eliminate all seed oils. Grapeseed oil, sunflower seed oil, safflower oil, rapeseed oil, canola oil, you name it. If it ends in seed, it's not good. Vegetable oil, is that good?
Nope.
No, why?
Because it's made out of.
Because vegetables aren't naturally fatty, right?
And it's not all vegetables.
Yeah. Now, olive oil, very fatty. Yeah, olives are very fatty, right? Avocado oil, avocados are very fatty. Those are healthy. So use that logic, right? I'm picking up this oil. What's it come from? Vegetables? Put it back. I'm picking up this oil. What's it come from? A cow, whose cow's milk is like this much fat and this much milk. And so they make butter out of it. Healthy or unhealthy? Healthy, because it's a natural occurring one. We have to also look at the other stuff here. So perfect your proteins. So our proteins are a really important component in this, especially when we're talking about metabolic or inflammatory arthritis types. If you're getting inflammatory proteins, so proteins that were raised in the wrong environment, were cows designed to eat corn? In extremely small amounts. Extremely small amounts of corn are fine for cows. But if all they eat is corn, And vitamins, what are they going to become? Well, what happened to me if all I ate was corn and vitamins? Blowed up, right? I wouldn't survive very long either because I'm not getting much protein. And so we need to get that in its natural environment. Cows are designed to eat grass. Chickens are designed to eat bugs. Let's see, fish are designed to eat other fish, mostly, unless they're eating the plankton or the kelp or the seaweed or other ocean creatures. You have to make sure they're raised in the right environment. If they're being fed food pellets, it's not going to be building healthy you. Trash or toxins. So much of our food is genetically modified so it can hold and support more pesticides. And we consume, it's estimated, about 200 pounds of pesticides a year. That's the standard American diet. The last one here, all of these can be the most important, just depending on where you're at. But this is the one that was my biggest holdup for years, was avoiding my allergens. It took me a while to identify my dairy sensitivity and then gluten sensitivity. Those were my two biggest ones. And that's not the same for everybody. You have to know what your food sensitivities are. And so the pulse test, everybody knows how to check your pulse, right? Count it out for 60 seconds, write down that number, and put the food that you think you might be sensitive to in your mouth and count it out for 60 seconds again. If your pulse goes up by 5 beats per minute or down by 5 beats per minute, then you're sensitive or allergic to it, at least right now. And that can change. So you have to, yeah. You just put it in and your body responds immediately, because remember, your nervous system is what's going to tell your immune system to respond to that. And so it does that immediately. Your pulse will respond immediately. And so you'll get that to go up or down by 5 beats per minute. So put it in, maybe give yourself a second to find a comfortable place so you don't accidentally swallow it, and then just hold it there and count that pulse out. And then avoid that food for a couple of weeks and then try it again and see if it's the same response. And sometimes it'll change. Your body's allowed to heal and adapt and respond. Sometimes it comes back, sometimes it goes away. So make sure you're identifying those things. Healthy fats. Every cell in your body is surrounded by a phospholipid bilayer. What does that mean? It's fat. And that membrane is not just protection, it's actually the brain of the cell. We've been told it's the DNA, it's the nucleus. No, that's just the instruction manual. The membrane is actually what is communicating into that DNA to say, hey, what do we do here? And then the instructions get changed when it's adapting to its environment. That's how epigenetics works. And so if this gets bad, if we go off of healthy fats, then the cells go bad. So we have to get those healthy fats in there. So we mentioned them: olive oil, avocado oil, coconut oil, butter, not for me, but for some of you. Ghee would be another one. Grass-fed for butter and ghee. What would be another one? Anybody got any other good ones? Am I missing any? I said coconut, but good. Good. I'm glad you're thinking of it. So eggs, best source of healthy fats, are actually the real foods that they come in. So eggs are better than egg oil. I don't know anybody drinking egg oil. Avocados are better than avocado oil. Olives are better than olive oil. Does that make sense? Yeah. The whole food versus the separated fat or the separated item. Anti-inflammatory foods here. So I give you a big hint, berries. But really, what are anti-inflammatory foods? They're the ones that contains the most antioxidants. These are the ones I can probably get you to eat the most of because they taste the best, right? But what are other anti-inflammatory foods?
What if you can't eat none of those?
Well, then find a different anti-inflammatory food. Yeah. Well, and some people that have trouble with this, like I've treated several patients with Crohn's disease. What we've had to do is we've actually just had to cook them a little bit. And by cooking them, we start to denature some of the things that would actually be rough on your digestive system. And so I challenge you to go home and do a food sensitivity test with it. Put it in your mouth, do the pulse check, raw, double check and make sure that you're sensitive to it. And then cook it and do the same thing. Yeah, turn it into a syrup.
How do you do that? I mean, what are you doing?
What are you cooking down? Yeah, so you put like a couple blueberries in the middle on the bottom of a saucepan, covered it in water, and then just let it broil for a little bit. And it'll turn into a syrup. That's actually what I do on my pancakes. So yeah, instead of maple syrup, just to keep the sugars down. But yeah, so green foods are also super anti-inflammatory. They actually have more antioxidants than the berries do. So broccoli, kale, spinach, cauliflower, Garlic is really high in that. Onions are really high in that. So those are your anti-inflammatory foods. Antioxidant-rich foods, I just mentioned that. But yeah, same thing. So here's another couple of Brussels sprouts. We mentioned the broccoli. That's an apple. Apples are actually anti-inflammatory. Tomatoes, get the tomato seeds out of there. They're pretty high in lectins. But a lot of people that can't do tomatoes can actually do tomatoes without the seeds. So,
Is that
huh?
Is that aroma?
It can be any tomato.
Just take the seeds out.
Yeah, try it. Double check it. Pulse check it. Take the seeds out and check it. Check your pulse. Salmon. Why is salmon up here? Check it. Check it. Salmon. Why is salmon so good? Omega-3 fatty acids. Vitamin D3. Do you know that there's only one food on this planet that has vitamin D3 in it naturally? Yeah, really. Otherwise, it's inserted artificially. Right? Where is it getting it from? The oceans. And when we're getting vitamin D3 as a supplement, that's typically where it's coming from. Otherwise, you have to get it from where? The sun, right? And for us Nebraskans, 2/3 of the year, we can't get enough from the sunshine. So we do have to supplement. But you're not getting a lot from salmon, but it is a place where you can get some. So definitely be looking at that. Mm-hmm. Yeah, you don't want corn-fed salmon, right? Where in the ocean is there corn, right? Wheat? Do they have wheat pellets in the ocean? Now they do, right? Okay, so next, detoxification strategies, right? We're exposed to all these toxins. We covered this ad nauseum last month. But 3 main keys with detox. Number 1, increase your hydration. If you're dehydrated, you can't detoxify. And that's not just water, that's also electrolytes, one way or the other. Some patients I have don't get enough electrolytes, they get too much water, and they need electrolytes in order to detoxify and get hydrated to detoxify. Others, they get enough electrolytes because they drink Powerade or Gatorade all day, and they're not getting enough water, and so it goes the other way. So I need to make sure we're getting that. Sweats. If you don't sweat, that's a problem. You have to make yourself sweat. Your skin is one of the largest detoxification organs in your body. If you're not sweating, then toxins are storing up inside you. It's just the way it is. There's certain things that can't come out unless you're sweating. 3, you need to do a cleanser or detox. I do one of these 3 to 4 times a year. And it's not just going to the store and buying a green juice. We actually have a 30-day supplement that we put patients on. It's the best detoxification supplement I've ever seen. It absolutely gets stuff out of you. You'll notice I go from 1 bowel movement a day to 3 bowel movements a day. But it's like, I eat pretty clean most of the time. You'd think I wouldn't have to, but no, it does. It stimulates it, and it actually gets me to go. I wouldn't do out of the blue just like a 3-day juice fast. Just go from nothing to a 3-day juice fast, or a week-long bone broth cleanse, or a water fast, because you can actually trigger toxicity reactions as you do that. So something like our detox system is actually much safer for that. So if you're dealing with arthritis, if you're dealing with pain, the supplements that I typically recommend to address those big 3 back there, the max omega-3. Why? Because the standard American diet is 17-to-1 omega-6s to omega-3s. That helps to get that back in balance. Max greens, for a scoopful of that, you get about 5 servings of vegetables. It's been juiced and powdered down so that you can actually get it, and it's chocolate. So who doesn't like chocolate, right? And then you've got curcumin. So I didn't really talk about curcumin, but when we're talking about antioxidants, one of the most potent anti-inflammatories, natural anti-inflammatories, is something called a curcuminoid, which is naturally occurring in turmeric. It's just not as intense as if we get it into the curcumin form. And so that comes better when it goes with quercetin. Quercetin actually helps it absorb into your body a little bit easier so that it's usable, as opposed to just taking turmeric by itself, or turmeric with black pepper, which can irritate the digestive system. So that's what I recommend if you're dealing with any level of pain. There's another supplement called Cell Repair that's our most intensive antioxidant formula out there that you may want to add to that list as well if you're dealing with arthritis or pain from arthritis.
Alone, what I mean, rather than other things combined with that.
So all of these I would take with food. Okay. Yeah. Most supplements, unless it says to take on an empty stomach. In fact, omega-3s help vitamin D3 absorb better, which is part of the reason why salmon is actually one of the few foods that has vitamin D3 in it. And then, you guys have seen, especially those of you that have been here for a year or more, just in the last year, I've been starting to push some doTERRA stuff, because what I realized is I didn't have a healthy option for you guys to manage some of the symptoms that you're dealing with. And I'm not an allopathic doctor at all. Like, I don't want you to treat your symptoms, because pain is there for what? To tell you that something's wrong. And if you don't know that something's wrong, what are you going to keep doing? The wrong thing. And you're going to hurt yourself. And so we don't want to block the pain signals. Like you said, embrace the pain, right? The pain is there for a very important reason. So we need to know why it's there, start addressing why it's there, mentally, emotionally, physically, spiritually. But then sometimes we need a good night's sleep. And the other thing I realized is we were designed to live in the Garden of Eden.
Mm-hmm.
And in the Garden of Eden, what is there? Buildings and streets and cars? No. Trees and plants and animals and sun and fresh air, all of which have all of these different phytochemicals that were actually beneficial. When we breathe, we give plants their food and their life. And when they breathe, they give us our food and our life. And it's way more than just oxygen and carbon dioxide. And so if you're dealing with arthritis pain, here's the protocol. Turmeric oil and copaiba oil. Twice a day, you're going to rub a couple of drops with coconut oil over the spot where it hurts. With your first meal, you're going to take 2 capsules of the turmeric capsule and the copaiba capsule. And then, as needed, you're going to apply the deep blue. And that's not only going to help you manage the pain without taking ibuprofen or Tylenol or aspirin or any of these other non-steroidal anti-inflammatories that'll wreck your liver, wreck your stomach, or wreck your kidneys. It'll keep you healthy while also actually giving you some things that'll help you heal faster. And so if you need to help manage pain and you want to avoid medication, then that's a good bridge to get you there.
Can you, so turmeric's, I've always been for turmeric's good to have on
Yep.
daily basis.
Yeah.
Anyway, can you supplement even using the oil? And as on a daily basis in your supplementation rather
Yeah.
than to do it as
needed. Yeah, you can absolutely. It depends on your situation, right? Turmeric is not something I do every day all the time. It's not one of my daily essentials that I do, but for some people it might be. I'm trying to get my antioxidants a broad spectrum from everywhere, but I will put turmeric into stuff. Absolutely. And it might be a good idea to start using that as a spice in foods, because it is an edible one as well. The other thing is exercise. So especially when we're dealing with degenerative arthritis, osteoarthritis. So 80%, right? 80% of arthritis is degenerative in nature. And so one of the main tools that we have in the fight against degenerative arthritis is movement. And I know we said it hurts to move it, but Cheryl didn't say, oh yeah, that's a great excuse, you shouldn't move it. What'd she say? Move it. She said she gave you a couple of different activities that you could do to take the weight bearing component of that off. If your shoulder hurts because it's got degenerative arthritis in it, you shouldn't just put it in a brace. Guess what that's going to do to the arthritis? It's going to make it go faster. We have to move it. And our bodies were designed for movement. If you're not moving the joint, it will start to get degenerative arthritis in it. Even if it's in the right place, it'll start to fuse together. If you don't use it, you lose it. So with exercise, the number one component is you have to find something that you enjoy. Because why? Because if you don't enjoy it, will you keep doing it? No, absolutely not. So you have to find something you enjoy. Number 2, do something that makes you sweat. It's going to be easier here over the next couple of months, won't it? Yeah, you just do it outside. Find something you enjoy, make sure it's outside. You'll sweat daily. And then 3, you have to stay hydrated. Make sure you get enough electrolytes in there. And so some of you have asked about the electrolyte packets that we have at the front desk now. Those aren't samples. We're selling those at $3 a piece, so you don't have to spend $90 to get a 30-day supply just to try it. But if you liked that, that's the most comprehensive electrolyte compound that actually tastes good that I've been able to find. And that one's through doTERRA as well. So those are the 3 things to make sure you're doing when you're doing exercise to reduce inflammation. And then peace management. So we did a big section there on meditation, not nearly as long as it needed to be, obviously. But when we're looking at stress specifically, we don't focus on the stress. We focus on creating peace. And so number one thing I would say is reduce your screen time. You know, whatever screen it is, just reduce it. It's there to create stress in your life. And sometimes that stress feels good and it gives you a little brain kick and says, hey, I want more of this. But that stress just loads up the overall stress. Like, it doesn't matter if it's physical, mental, emotional stress. It just starts building up. And when you hit capacity, that rolls over into symptoms. And so reduce that screen time. What's a healthy amount of screen time? Well, how many screens were in the Garden of Eden? That's my default answer. Does it mean that I get 0 screen time? No, what am I looking at right now? What's back there? What's in there? Like, it's all the time, right? So we have to have a healthy balance with that. Make me time. And me time is I can't tell you what that is. That's something that you have to pick out on your own. So you might know exactly what it is when I say that, but find something that you do that you enjoy that helps you decompress. Time in nature. We know this, forest bathing. You know, we've talked about this in the past. Getting out in nature, even just the sight of a tree out your window decreases the stress levels compared to not having a sight of a tree out your window. Yes, ma'am.
My nephew says to take your shoes off and walk through
Yeah,
grass.
yeah, grounding. Like this is not a workshop on grounding, but you know, I think I may have gone the entire winter without touching real ground or real grass. I took my shoes and socks off like as soon as it was warm enough to, and I actually felt almost like a discharge from my body into the ground. It was weird. I'd never noticed it before, but I was paying attention to it because I've been learning more about grounding. I'm like, I think I might feel it if I pay attention to it. And when I did notice it. And so I've been making an effort to get outside once a day, barefooted, just to do that. I know there are products you can buy, but do the cheap one, get outside, take off your shoes, right? And then the last one here, prayer and meditation. Absolutely. You know, you're trying to get into that theta brainwave state. And that's the most important place to be. And prayer and meditation both have it. So make sure you're taking time to do that on a daily basis. So action steps. I'm about done, and I know I've gone over time. I try to make these an hour and a half, and we're at an hour and 35. But if we don't do anything out of tonight, what did we just do for the last hour and a half? We wasted an hour and a half. And while it's always good to see your beautiful faces, I don't want to waste anybody's time. And so what I want you to do right now, most of you have paper in front of you. I want you to write down 1 or 2 action steps that you are going to do either tonight or tomorrow. Why tonight or tomorrow? Because if you don't do it within the next 48 hours, you're not going to do it. Research says that if it's not done within the first 24 hours, it's not going to happen. And so make sure it's either done tonight or tomorrow, and you set up a process for doing it. For some of you, that might be grocery shopping a little bit different. For others of you, that might be getting adjusted a little more often or doing home exercises a little more. Some of you, that might be calling Taylor over there and saying, hey, teach me more about this meditation stuff, or let me just talk to you a little bit about some of the stuff I got going on. For the others of you, it might be, you need to do more time in prayer, or more time reading the Bible, or more time not watching Fox News or CNN or CBS or whatever, or just not being on Facebook, or not, I can't tell you what that is. Now, I can look at your spine and say, hey, this needs to be adjusted more frequently or less frequently. Or I can look at your food journal. If you want to fill out a food journal, I can tell you what we need to address and what we need to change in there. Now, some of you need to fill out an LRQ, because that lifestyle risk questionnaire just is going to tell me more about what's going on inside your body. So just make sure you're making that note on what to do. And for all of you, one of the action steps that we should be doing in the next month is the next class. So a month from now, approximately 4 weeks, I don't know the date off the top of my head, but our next class that we're having is actually on the immune system. It's called self-defense. I don't have a dry erase marker, but CELL-F, defense. And clever wordplay, right? Is that June 10th? Okay, so not a full month, but yeah, coming up in the next couple of weeks here. So make sure that that's on your calendar. Look for the sign-up sheet up front. And then what should we be doing is bring in our friends. Because is there anybody else that wasn't here that should have heard this information tonight? Yeah, I can think of like everybody, right? Because who's going to get arthritis if we do nothing and keep living lives? All of us. Who's going to end up in pain? All of us. What's the number one cause of disability in the world? Low back pain, followed by neck pain. It's like, if it's not chiropractic, it's probably nutrition. And if it's not nutrition, it's probably stress. And if it's not stress, it's probably toxicity. And if it's not toxicity, it's lack of exercise. And it's probably all 5 of those things. And honestly, and so if all you do is just 1 or 2 things better every time you come to one of these classes, by the end of the year, you're going to be a completely new and renewed and healthier person. And so keep working at it. So tonight, if you needed any supplements, we've got everything's 15% off tonight. If you want one of the featured ones, then your supplement purchase tonight is 20% off the entire purchase. Plus, you all got Wellness Warrior cards, so that's 5% off plus the amount of punches that you got. So every time you come to one of these classes, you get another punch. So by the end of the year, I'll be paying you to buy my supplements, right? No, because I don't have enough classes for that to work out. But yeah, so make sure you're coming, make sure you're signing up, make sure you're bringing friends. And then I don't think we put it on the calendar yet. Oh, we did, Friends and Family Week. So if you know somebody that needs an exam, we're going to be doing a free consultation and digital nerve scan for anybody that's curious about chiropractic or just wants to see what Dr. Jake's office is like or wants to meet with Cheryl.